Stop for a moment before you spend another dollar on lifting creams, tightening masks, collagen gadgets, or one more miracle serum that promises to pull your face back 10 years overnight, because the truth is, most of those products are working on the very top layer of your skin while the real age-related change is happening underneath. If your cheeks have started to sink, if the corners of your mouth seem lower than they used to be, if your jawline looks softer in photos and the mirror feels less kind than it once did, then what I'm about to share with you may completely change how you think about facial aging. Because sagging is not just a skin story, and that is the part almost nobody explains clearly. Yes, collagen matters. Yes, sun damage matters. Yes, hydration matters. But there is another piece of this that often gets ignored, and once you understand it, the whole puzzle starts to make sense. The face is not simply skin stretched over bone. It is skin, fat, connective tissue, and a living layer of muscle underneath that gives the face shape, lift, tone, and expression. When that deeper support becomes weaker and flatter with age, the surface above it starts to drape differently, and that is when you notice heaviness. Now, if you're over 60, you have probably already seen exactly what I mean. The upper cheeks don't look as rounded. The lower cheeks start to fall inward and downward. The smile lines deepen even when your face is resting. Jowls begin to show up where you never had them before. And then you start being told the only answer is to inject, freeze, fill, peel, cut, or cover. But I want to have a more honest conversation with you today, because while no single movement replaces surgery, there is one facial exercise that stands above almost all the rest for giving the face a firmer, more supported look when it is done correctly and consistently. I'm talking about the cheek lifter, and if you stay with me, I'm going to show you why this one matters so much, how to do it properly, the 3 mistakes that make it useless, the 1 feeling you should be looking for while you do it, and how to know whether it is actually helping your face or whether you are just moving skin around for nothing. And I want you to stay to the end, because I'll also explain why this movement can affect not only the mid-face, but the lower face, the nasolabial folds, and even the early appearance of jowls more than most people realize. Before we begin, please subscribe to my channel so you never miss simple, science-backed guidance for skin, strength, and confidence. Now, here is what fascinated me when I first began looking closely at facial exercise and facial aging. In a small human trial, people who committed to a structured facial exercise program for months were judged to look younger at the end, and the biggest visible improvements were seen in the cheeks. Not the forehead, not every wrinkle everywhere. The cheeks. That matters because the cheeks are the central support columns of the face. When the cheek area loses fullness and tone, everything below it starts to look more tired. The lower face appears heavier, the fold beside the mouth deepens, and the jawline loses that quiet definition that made the whole face feel fresher. Think about the face like a tent, not a flat sheet. If the center poles of the tent become shorter and weaker, the fabric begins to sag outward and downward. You can smooth the surface with your hands for a moment, but it will not hold unless the support under it improves. The cheek muscles, especially the ones involved in lifting the corners of the mouth and raising the mid-face, can influence how supported that whole area appears. That is why I am not giving you 10 random facial movements today. I am giving you the one I would prioritize if your biggest concern is that fallen, hollow, tired, soft look through the middle and lower half of the face. And let me say something important right here, because I want to be fair with you. If you are expecting one exercise to erase every line, tighten very loose skin like surgery, or reverse decades of sun damage in a week, that is not realistic. But if what you want is a natural, no-cost, daily way to wake up the support system of the face, improve tone, create more lift through the cheeks, and help your face look less collapsed and more alive, then this is where I would begin. And frankly, for many of you watching, this is the exact place you should begin before spending money anywhere else. So what exactly is the cheek lifter, and why is it so effective when done right? It is a targeted movement that activates the cheek muscles without letting the neck, forehead, or jaw take over. In simple terms, you are teaching the cheeks to lift upward instead of allowing the whole face to keep drifting downward. That upward direction is everything. Most people make the mistake of stretching the skin sideways, pulling at their face with their hands, or over smiling in a way that creates strain around the eyes and mouth. That is not what we want. We want controlled lift, not distortion. We want muscle activation, not skin dragging. Here is how to set yourself up, and this part matters more than people think. Sit or stand tall, keep your shoulders relaxed. Let your neck be long but not stiff. Your jaw should feel loose, not clenched. If you do this while hunching your shoulders or tightening your neck, you will immediately recruit the wrong muscles and you'll wonder why your face feels tired but never looks better. Start with a clean face and clean hands. You do not need oil and you do not need to press hard. In fact, too much pressure is one reason people crease the skin instead of training the muscle. This must feel precise, gentle, and deliberate. Now for the movement itself, I want you to imagine making a soft O with your mouth, not a big exaggerated O, just enough to lengthen the mouth slightly. Then fold your upper lip gently over your top teeth. This is not about baring your teeth or forcing a strange expression. It is a setup that helps isolate the cheek area. Once you are there, begin to smile upward with the cheeks, not wide with the lips. That distinction is crucial. The mouth stays controlled while the cheek muscles rise. If you place your fingertips very lightly on the top of your cheeks, you should feel the muscle lift upward under the skin. From there, relax the cheeks slightly and lift again. Relax slightly and lift again. Think of it as a slow pulsing upward action, not a frantic repetition. 10 good lifts are worth far more than 50 sloppy ones. On the final lift, hold the cheeks high for a count of 10 while keeping the neck soft and the forehead relaxed. If your forehead is bunching, you are cheating. If your jaw is gripping, you are cheating. If your neck cords are popping out, you are cheating. The cheek lifter works when the cheeks do the lifting. That is why I would rather see you do 5 excellent repetitions than a whole routine of uncontrolled movement. What should it feel like if you are doing it correctly? You should feel a mild working sensation high in the cheeks, close to where the cheekbone meets the fuller part of the face. It may feel strange at first because many people have never deliberately activated those muscles in isolation. You may even notice one side is weaker than the other, and that is incredibly common. Most faces are asymmetrical in how they move. One cheek may rise faster. One corner of the mouth may want to dominate. One eye may squint more. That does not mean the exercise is wrong. It means your face is showing you where the imbalances already are. And this is where most people quit too early because the first few days can be humbling. You look in the mirror, try to do the movement, and realize your mouth is taking over, your eyes are squeezing, your neck is joining in, and your whole face feels awkward. Good. That awkwardness means you are finally paying attention to muscles that have been underused or poorly coordinated for years. Nobody expects to walk into a gym and deadlift perfectly on day one. The face is no different. It is a physical practice. It needs control, direction, and repetition. What matters is not whether it feels graceful immediately. What matters is whether it becomes cleaner week by week. Let me tell you about Eleanor, a 69-year-old grandmother who told me her biggest frustration was not wrinkles by themselves. It was that her face looked as if it had slowly slid downward. Her exact words were, "I don't mind looking older. I mind looking defeated." That stayed with me because it captures what so many people feel and struggle to say. She had tried rich creams, facial rollers, and expensive brightening products, but what bothered her most was loss of shape. After several weeks of practicing this lift consistently and gently, the first thing she noticed was not fewer lines. It was that her face looked less heavy through the center. That is often how progress begins, not with a dramatic before and after overnight, but with subtle structural changes that make the whole face appear more rested. The cheeks look a little more awake. Makeup sits a little better. The lower face seems less pulled down. The smile looks more supported. Then other people start saying things like, "You look well," or "Did you change something?" That is the kind of change facial exercise can create when it helps restore a bit of tone and fullness where the face had flattened. It is not magic. It is not instant, but it can be very real, and because it is gradual, it often looks more natural than almost anything else. Now let's talk about the 3 biggest mistakes because these are exactly why so many viewers try face exercises and then announce they do not work. Mistake number 1 is using the mouth instead of the cheeks. If your lips are doing all the movement and the cheeks stay quiet, you are rehearsing expressions, not training support. Mistake number 2 is lifting the eyebrows. The moment the forehead joins in, the work shifts away from the mid-face. Mistake number 3 is pulling the skin with your fingers. Your fingers are there only to monitor the lift or guide awareness, not to drag the face upward. If your hands are doing the work, the muscles are learning nothing. Here is another mistake people rarely notice, and it is a very important one if you are over 60. They use too much force. They think harder must mean better, so they strain, clench, hold their breath, and compress the jaw. But facial training responds much better to precision than aggression. Your face is not your quadriceps. These are smaller muscles layered with delicate skin and expressive habits. You are trying to create controlled lift and improved tone, not brute force. If the exercise leaves your jaw aching, your temples tight, or your neck sore, back off. The goal is targeted activation, not tension spreading across half the head. So how often should you do it? If you want a fair chance to see change, my advice is simple. Start with 5 repetitions, holding the last one for 10 seconds once a day, 5 to 6 days a week. After 2 weeks, if it feels comfortable and clean, you can build to 10 repetitions. That is enough. You do not need 30 minutes in the beginning. You need consistency and quality. For some of you, mornings work best because you are fresh and less tense. For others, evenings are better because you can slow down and focus. The time of day matters far less than whether you actually keep showing up long enough to let the tissue adapt. And I want to say something about timelines because unrealistic expectations ruin good habits. In the first week, what you may notice is simply awareness. You begin to feel where your cheeks are and how little they have been truly lifting. In 2 to 4 weeks, you may notice slightly better control and a more responsive mid-face. Around 6 to 8 weeks, some people begin to see a modest improvement in how supported the cheeks appear, especially in certain lighting or when the face is at rest. By 3 to 5 months, if the movement has been practiced correctly and consistently, that is when visible change becomes much easier to judge honestly. If you want this to work better, there is one more principle you must understand. The cheek lifter can be excellent, but it does not live in isolation from the habits that keep pulling the face downward. Constant mouth breathing, poor sleep, chronic jaw tension, dehydration, smoking, and relentless sun exposure all work against the look you are trying to create. So if you do 5 minutes of beautiful facial exercise and then spend the rest of the day clenching your jaw, frowning at your phone, sleeping badly, and skipping sunscreen, you are fighting upstream. The exercise is not supposed to rescue every other habit. It is supposed to be part of a better direction. That means posture matters more than most people realize. If your head is always leaning forward, your neck is tight, your jaw is compressed, and your lower face is dragged by gravity and tension all day long. Lift through the crown of your head. Relax your tongue away from pressing hard into the teeth. Let the shoulders fall. Breathe through the nose when you can. These may sound like small details, but the face responds to the body it sits on. A supported neck and calm jaw create a much better environment for the cheek lift to actually do its job. The face loves alignment far more than it loves intensity. Now some of you may be wondering why I chose the cheek lifter over jawline moves or neck exercises if your biggest complaint is jowls. Here is why. Jowls are not only a jaw problem, they are often a support problem from above. When the mid-face looks flatter and lower, the lower face looks heavier by comparison. Restoring even a modest amount of lift and fullness higher up can change how everything beneath it reads. In other words, the upper structure influences the lower impression. That is why I keep bringing you back to the cheeks. They are not a cosmetic side note. They are central to the architecture of a more youthful looking face. I also want to protect you from the trap of over-promising because the internet does that enough already. If someone tells you one exercise will tighten every face 100%, erase every fold, and work exactly the same for every age and every skin type, that is not education. That is marketing. What I can tell you honestly is this: among all the facial movements people try, a properly performed cheek Lifting movement has some of the best reason behind it and some of the best visible logic behind it because cheek fullness and cheek support are so deeply tied to how old or tired a face appears. That is why this is the one I would build around first. Let me walk you through a clean repetition one more time because precision is what creates results. Sit tall. Relax the shoulders, make a soft O with the mouth. Fold the upper lip gently over the top teeth. Keep the jaw loose. Now smile upward through the cheeks without pulling wide through the lips. Lightly place your fingertips on the upper cheek so you can feel the lift. Relax slightly, lift again. Relax slightly, lift again. Do this slowly 10 times. On the last one, hold for 10 seconds while keeping the eyes soft, the forehead quiet, and the neck relaxed. Then release completely and let the face rest before repeating. After you finish, do not immediately judge the mirror with panic. Sometimes the cheeks will look a little more alive for a few minutes simply because blood flow has increased. That is normal, and it is not the whole story. The real changes come from repetition over time, not a temporary flush. What you are looking for over the long term is better tone, more control, a slightly more supported resting face, and a mid-face that looks less collapsed. Those are meaningful changes. And for many of you, especially if you feel your face has begun to look tired rather than simply lined, those may be the changes that matter more than anything a cream could ever give you. Who should be cautious with this? If you have jaw pain, active facial pain, severe TMJ issues, recent facial surgery, injectable recovery, nerve problems, or a skin condition that becomes worse with movement or touch, speak with a qualified medical professional first. If the exercise creates pain, stop. If it creates a headache, stop. If you are forcing the motion so hard that your face feels strained instead of worked, stop and reset. There is no prize for suffering through it. Facial training should feel focused and controlled, never harsh. You are trying to build a supportive habit, not punish tissue that is already stressed and sensitive with age. Now I want to address one emotional truth that many viewers carry quietly. Sometimes it is not really about vanity. It is about recognition. It is about looking in the mirror and feeling that your expression has become heavier than your actual spirit. It is about seeing a tired face on days when you do not feel tired inside. It is about noticing that photographs seem to capture fatigue instead of warmth. That is why these conversations matter. They are not merely cosmetic, they are personal. When the face begins to lose lift, many people feel as though the world is reading the wrong story on them. They feel gentleness inside and wariness outside. And that is why I like natural interventions that give you back some agency, because especially after 60 is bad, it is not. Aging is a privilege. But being told you must passively accept every unwanted change without trying safe, intelligent, low-cost strategies first is not wisdom. It is surrender. The cheek lifter will not make you 25. That is not the job. The job is to help your face feel more supported, more awake, more like you. Sometimes a small return of shape and tone changes the whole emotional relationship you have with your mirror. And I never underestimate the value of that for confidence, posture, or how you move through a day. If you do decide to practice this, take one photograph in natural light before you start, and then another after 8 weeks, and another after 12. Same angle, same expression, same time of day if possible. Memory is unreliable. The mirror is emotional. Photos, when kept consistent, can tell you whether the cheeks truly look a bit fuller, whether the lower face appears less slack, and whether the overall expression seems brighter. Do not check every morning and torment yourself. That is not useful. Give the body enough time to respond, and then compare calmly. Structure changes slowly. You are measuring a physical adaptation, not a fleeting mood. And if one side is weaker, do not panic and do not overwork that side aggressively. Instead, slow down and focus on symmetry of control. Sometimes it helps to practice in front of a mirror and think less about how big the movement is and more about where it begins. The movement should begin high in the cheeks, not at the lips, not at the chin, and not in the eyes. If one cheek wants to lag behind, use your fingertips lightly as a cue and simply keep practicing. Many people discover that asymmetry improves not because the face becomes mathematically perfect, but because the weaker side becomes more responsive and coordinated over time. There is also a mental benefit to this kind of routine. And I do not think we talk about that enough. Spending a few minutes each day paying attention to your face with patience instead of criticism changes something. You stop attacking yourself in the mirror, you start observing, you start learning, you notice habits, tension patterns, holding patterns, and expressions you carry all day without realizing it. That awareness alone can soften the face. The cheek lifter becomes not only an exercise, but a daily interruption of stress, jaw gripping, and resignation. And in that sense, the effect is bigger than appearance. It reconnects you with the body instead of making you feel betrayed by it. So if you ask me for the one face exercise I would put at the top of the list for sagging skin, especially when the face is losing shape through the mid-face and beginning to look heavier below, I would choose the cheek lifter. Not because it is flashy, not because it is trendy, and not because it promises nonsense. I would choose it because the cheeks matter enormously to how youthful the face appears, because improved cheek support changes the whole composition of the face, and because this movement trains an upward action exactly where so many aging faces need it most. That combination makes it special, and frankly, it makes it worth your time. Give it 8 solid weeks with clean form and realistic expectations. Do not chase perfection. Do not yank your skin. Do not rush. Just practice the lift, protect your skin from the sun, sleep as well as you can, drink your water, keep the jaw softer, and let consistency do what intensity never can. The body responds to repeated signals. The face does too. Every careful repetition is a signal upward. Every day you do it well, you are reminding your face not simply to move, but to support. And for many of you, that may become the beginning of a face that looks less fallen and far more alive. If this helped you, tell me your age in the comments and the one area of your face that bothers you most right now: cheeks, jawline, neck, eyes, or smile lines. I read those comments carefully and they help me decide what to cover next for this community. And if you try the cheek lifter for the next few weeks, come back and tell me what you noticed first. Was it better control, more fullness, less heaviness, or simply a face that looked more like your own again? I would truly love to hear your experience, and I'll see you in the next video.